going to wait for you. Your go ahead.
Yeah, Dr. Pruthi, let's wait a few more minutes. I always try to wait probably until like about 5 after.
Yeah.
Because people are tending to log on a little bit later than 6. So let's see.
Pruthi, I'm here. It's Gats. I'm on the phone, so you won't see me like with my name. It just shows up as my phone number.
Okay, great. Thank you.
We'll get started in just 1 minute, everyone. All right, Dr. Pruthi, we can probably get started.
Great. Okay, thanks. Welcome, everybody. We really appreciate you coming out tonight for this virtual meeting. And we know that some of you, many of you may not have had a chance to come and visit us in San Antonio, and some of you were able to. And so this is just going to be 1 hour where we're going to spend some time together. And I think, as you meet the faculty, we're going to be able to answer a lot of the questions you might have had you have had a chance to rotate here. We all understand that COVID gave us a lot of restrictions, and so this is the second year that we're doing this virtual meet and greet, and last year it was pretty well received. You may have seen the agenda, so we're first going to start with just some welcomes and greetings. Then the faculty are going to each individually talk about their areas of expertise. Many of them, all of us, have come from really other centers, other cities across the country, and so we can give that perspective. And there were some questions that were submitted, prior to this meeting, and we've integrated some of those questions. So some of the faculty members will be sort of zeroing in on those questions, and then at the end, if any of you have any questions, of course, we'll address those. So first, I'll just kind of talk very briefly maybe about San Antonio, because many of you may have not come here. Maybe this is not, the #1 city that you ever think about when you're want to live somewhere for a number of years. But I came from Canada, and so for me, coming here was very different. I would say there were a lot of advantages of living in San Antonio, especially if you're a trainee. And so affordability is something many residents really should think about. The city is actually a pretty nice city. The traffic isn't bad. There's a lot of things to do. If you have a family, we have SeaWorld, we have a number of amusement parks, Six Flags, and whatnot. So there's a lot of cool things that draw people to the city. It's a very much a tourist city. And if you're into outdoors activities, we have the Texas Hill Country. It's kind of like our own version of Napa Valley, maybe not quite the same as quality of wine, but it's really cool. And there's a lot of people bike and whatnot. So there's a lot of cool things to do. So if you haven't had a chance to come out here, I don't think you would be disappointed. The weather is great year round. It's warm. And so when we moved down here, my wife told me she'd be happy if she never saw snow again. So that, for the most part, has been true, other than our Snowmageddon fiasco a few months back. So first, what we'll do is there's a number of you on here, and what we want to do is we just want to give you a chance to introduce yourselves. We're not putting you on the spot, but you're just, tell us your name, where you're from, and maybe just some sort of fun fact about you. It doesn't have to be comical. You can just tell us something, like maybe you played, in the band in high school, or were on the chess team or something like that. Maybe you come from a large family of, seven siblings or something like that. So, any little quick quirk that you can tell us about yourselves, and we'll go down the list. I want to make sure that I don't miss anybody here, so I'm going to show all the participants. And all right, I'm going to start from the bottom of the list because everybody starts from the top, and I'm just going to change it up a little bit. So and if I miss you, please kind of interrupt me, okay? So we'll start from, is Zachary Seymour there?
Yes, sir.
Hi.
Hey, everyone. My name's Zach. I'm originally from Lexington, South Carolina. I went to the University of South Carolina for college and for med school. But currently I live in San Antonio. I'm completing my transitional year internship at Brooke Army Medical Center. And I'm applying into urology. Oh, shit. Fun facts about me, I guess. I enjoy playing tennis. I played it since I was a small child, and growing up in the area, I'm obviously a huge Gamecock football fan. So that's another huge interest of mine, even though we're not doing so great lately. But
Great. Wonderful. Thanks, Zach. Next we have, is it 10, or maybe I said it's Jenny Elizabeth 10 Eek? I'm going to say that wrong. I see you there.
Yeah, it's 10 Ike, like Mike and Ike.
Okay.
Yeah. So my name is Jenny. I'm from the University of Toledo. I'm originally from Toledo, but I went to Pitt and then Georgetown for undergrad and graduate school. So I'm applying this urology this year. And fun fact, I'm fluent in American Sign Language.
Oh, wonderful. Great. All right. Next we have Sydney Sohedin. Correct me. I know I'm going to butcher these.
That's okay. It's Sydney Sahudin. So it's nice to meet all of you. I'm from Kansas City, Missouri, and I go to school at the University of Missouri in Columbia. And I go there for medical school, and I went there for undergrad as well. Fun fact about me is I play the harp, and I used to play for weddings.
Wow, wonderful. Sure you made some good money.
Oh, yes.
Yeah. All right, I saw Spencer Bell.
Hey everybody. Yeah, my name's Spencer. I'm from North Carolina. I went to NC State for undergrad, and now I'm at East Carolina University for medical school. I guess fun fact about me is I'm also really into sports. They pretty much ruled my life growing up. Big Carolina Panthers fan, and obviously I cheer for NC State football as well. And they had a big win over Clemson over the weekend, so I've been pretty happy this week.
Awesome. It's fantastic. All right, Samuel Pettit.
Yes. Hello, everyone. I'm calling in from Portland, Maine, not too far from Canada. But I went to Brigham Young University for my undergrad, which was in finance, so I didn't have any of the science classes. So I did a post-bac at Harvard, and then I'm at UNE now, University of New England. And fun fact about me, I guess I would say I toured England and Scotland as a jazz trumpet soloist.
Oh, wow, wonderful. Cool. All right, thank you. Carissa Redmond.
Hey everyone, my name is Carissa. I'm from Florida originally. I went to undergrad at Florida A&M, and I'm a fourth year at the University of Texas Medical Branch in Galveston now. Fun fact about me is I used to be a chemical engineer.
Oh, cool. Awesome. All right, Rachel Pham.
Hey, I'm Rachel. I was born in Houston, went to undergrad at UT Austin, and then I'm back at McGovern Medical School in Houston for my medical school. Fun fact about me is that I was actually on the rowing team in college in Austin.
Awesome. We had one resident who was on the rowing team at UT Austin, actually, Jesus Herrera. He just graduated. That's great. Kayla Hudson.
Hi, my name is Kayla Hudson. I'm a fourth year at Texas A&M University, AWU, and I went to A&M as well for undergrad. I'm originally from New Orleans, but I would call Houston home as well. Fun fact, I can speak conversational French. I kind of learned it from my great-grandmother and then stuck with it in high school, and then in college got a minor, so.
Wow. I used to know French, but now I've moved here, so.
Spanish is much more useful.
Yeah. All right. And then next we have, is it Kalon Morgan?
Hi, yeah, my name's Kalen Morgan, kind of spelled
All
funny.
right.
Man, you people are cool. So me, I'm originally from Utah. I'm from a really small town no one knows called Circleville, Utah, 500 people. I went to medical school. I'm going to medical school at Rocky Vista University in Southern Utah. Currently doing research at the University of California, Irvine, and then I'll head back and do fourth year. Interesting thing about me, I guess, I am fluent in Spanish. Lived in McAllen, Texas for a few years, so south of San Antonio. And then I did stand-up comedy in undergrad, so I'm not near as talented as you people, but.
Wow. That's pretty brave. Good for you. All right, Jolie Shen.
Hi, everyone. My name's Jolie. I don't have my camera on right now because I'm baking a cake for my partner's birthday. But I'm originally from Seattle. I went to undergrad in Chicago, but my husband went to UT Austin, so I spent a lot of time in Texas. And now back in Seattle for med school. Fun fact about me is that I golfed in high school and college. I played golf.
Cool. What kind of cake are you making?
I kind of oversold myself. I'm making a Rice Krispie cake because that's his favorite dessert.
Okay. Okay. All right, great. James Charles.
Yeah, hey everybody. I'm a fourth year at OU Tulsa campus. I grew up in Central Texas, a small town called Hillsboro. And then I went to college at also a small college in Georgetown, so North Austin, Southwestern University. And then I'm actually down here in San Antonio right now with the Department of Peripheral Rotation. Fun fact about me is I took 4 years off in between college and med school to do golf biomechanics research in California. So, Jolie, if you ever want to talk golf, let me know.
Wow. I may
Yes,
get
definitely.
a few pointers from you too. All right. There are a lot of golf courses here in San Antonio, actually. A lot of really good ones. All right. So Riley Carr.
Hey, I'm Riley Carr. I'm originally from New Orleans. Went to undergrad, and I'm currently a fourth year at University of South Carolina. Fun fact about me is I would consider myself to be a really talented chef.
Okay, great. What's your dish? What's your kind of go-to?
Homemade pastas.
Homemade pastas, great. All right, and then we got a few. One of them I know is Dr. Getz. Anybody else on a phone number here? You can speak up and introduce yourself. I could maybe start. There's
Hi
one
there.
that
Can
says.
you guys hear me?
Yeah.
Okay. My name's Aaron Stewart. So I am originally from Yakima, Washington. Did my undergrad and med school at UW, and I'm actually doing a transitional year at Madigan Army Medical Center this year. Fun fact about me, I am a little bit of an adrenaline junkie, and I like to ski up and down volcanoes.
Oh, cool.
Yeah.
I went to
I will join in via Zoom once I get home. I'm driving home at the moment.
Okay. I thought maybe you were on top of a volcano or something. All right. Great. Okay. Well, thank you. Is there anybody else that I missed? I don't. It's just want to make sure we get everybody. Okay. Sounds like we got everybody. So we'll move to the kind of meat of this meet and greet, if you will. So I'm going to start with Dr. Sung, actually, because he's been here the longest, and I think he can bring kind of the greatest insight to the program and how things have changed. And he's got a few questions that he'll address from the previously submitted questions. So, Dr. Sung, are you available?
Hi. I'm Dr. Tsung. I've been here for 11 years, and I do most of kidney stones here. So, and most of the residents, or all of the residents, rotate through with me one-on-one for 3 months in their first year. Fun fact, I guess, I have 2 kids. They're first and second grade, and it's the relief that they're in person, but since nobody's wearing masks at school, it's it's a little nerve-wracking still. So let's see. Your spreadsheet is very small.
Yeah, so I can maybe I can tell you some of the questions we thought you would be best for. So how about, can you speak to the mentorship structure, because you provide that mentorship role in the Stones, and maybe talk about how that works for the residents and how much time they spend with you, what kind of cases they get to do.
Yeah, so in your first year here, you rotate with me for 3 months. You rotate with Dr. Kraus, who's our kind of voiding dysfunction female pelvic medicine person, for 3 months. I believe the other place is the VA, I thought. And then
you got the VA and the pediatric.
And pediatric, yeah. So with Dr. Getz for 3 months. And so that, I think, it gives you a pretty good introduction to kind of the bread and butter type things that we do. I think at the VA, in their first year, they do a lot of clinic and a lot of office procedures, so they get good at doing that. As far as other ways that we do mentorship here, everybody who comes here has 2 mentors. One is a research mentor, and one is a kind of a clinical mentor. And the clinical mentor is the person kind of you would go to if you're having problems, and also to talk to about how you would find a job afterwards and things like that.
Wonderful. And I see Dr. Koshik is with us, so I'm going to maybe give a couple of questions to him as well. But how about, what do you think, you've been here for the longest. One of the questions was, what are you most proud of with respect to the residency program, especially how things have changed? Maybe if you could comment on that.
Yeah, so when I got here, the residency probably was already in the structure in terms of the number of people per year was the way it is now. They had just gone to 4 residents per year, and they jumped from just 2 per year to 4 per year. So it was a big jump. And at that time, they, en masse, took a bunch of residents from SAMC, which is a military program on the other side of town. Things that I think I'm probably most proud of is, or in general, I think our program is a very high volume program, and we have, and it may be because we live in South Texas and there's a whole stretch of South Texas from San Antonio to the Mexico border that is probably underserved in terms of medical care. And so we see a lot of complex things, and Dr. Peruthi gets to take care of those, and so does Dr. Koshik. I think most of the residents are very comfortable, or more comfortable than most residents graduating, and doing things like tumor thrombus cases and cystectomies and bowel diversions on their own when they graduate. For me personally, since I do, I also get my own access for the PCNLs, and it's the most satisfying thing for me is when you guys graduate and I find out that you guys are actually doing it on your own and not having radiology do it for you. And not everybody is that comfortable, but a lot of them do get comfortable enough to do it on their own. So we have several residents who are in South Texas and also out in kind of more rural areas where they're doing their own access and doing their own PCNL access. So that's kind of the thing that I think is the fact that you guys can do complex stuff on your own very comfortably when you graduate is what I think I'm most proud of.
Yeah, wonderful. And, I would say, having come down here, I felt that the residents were very much, beyond, where I was, as a first, as a U1 or a PGY2 resident, with their exposure with you and stones, and they come out really capable with percutaneous access. And, we're in the South, and many of you guys are from the South, so sort of the patient population, the BMI is pretty big. And so there are some pretty cool pictures of some of Dr. Sung's patients where, he's had to tackle some of these pretty big complex stones with PCNLs and with multiple access sites. And so they get a lot of that experience. Great. So why don't we move to, how about we go to Dr. Getz. Dr. Getz, so how about you just introduce yourself and talk about your training, and then I can read the questions if you want as well for you.
All righty. Hi, guys. My name is Dr. Getz. I'm the pediatric person for the department. I actually did my residency in urology here in San Antonio at UTESCA. Actually, I would consider Houston to be my hometown, but actually was born in South America. So even when I was, coming from Texas, we always heard of San Antonio, everybody preferred to go to Austin. So I did my undergrad in Austin, and I landed here in San Antonio because back in the day, I wanted to be a trauma surgeon. So I came here and to seek, the level 1 trauma here, but I didn't know much about urology back then. And it wasn't until my intern year that I found out, what urology meant and what it was all about. So I made a switch. I didn't ever thought that I was going to stay here in San Antonio, and to look where I'm at. I came back after I graduated from urology residency. I went away and did my fellowship in pediatrics in Wisconsin, and came back here, and then that's where I'm raising my family. I got 2 little girls, 4-year-old and 18-month-old right now. In terms of feedback, I know some of you guys are asking how is it that residents get feedback. There's different ways of giving feedback. Either you do it on the spot, like the time you're doing clinic with your particular attending, or in the operating room during procedure, after the procedure. But we also do formal feedback. We actually have red cap based urology feedback forms, and they're formatted for both the operating room and clinical settings. So usually at the end of the day, you're supposed to submit those, and you do kind of like a self-assessment, how well you thought you did procedure, prepare for the procedure, took care of the patient after the procedure, and the attending will fill out those same questions, and then you can compare your answers to the attending's answers, kind of give you an idea if you're, how you evaluate yourself kind of matches up with what the attendants are seeing. And those are, we keep it on a database, but you also get the results immediately. So you'll see, okay, today, so-and-so told me I did very well, and then this is what, the evaluation shows as well. So you know what to improve upon, day to day. Let's see, another question, I think I was referring to work-life balance. We try to, this residency, over the years, this residency program has definitely become, many more of the residents are married, they have kids. So we really try to respect that the time outside of work, and then try to not overburden you with work if it's not necessary. Try to make you guys efficient, so that way you can get done with work and go home. Pre-COVID, we used to actually hang out a lot. We will have get together, like a summer picnic. We had holiday parties, and of course graduation. COVID has changed that a little bit, but definitely for the first, like 2020, but slowly we're gaining that back. Let's see.
And then the last one. Yeah, there's one which I think is pretty easy for you, but how do the residents progress each year of training? Maybe we want to talk about our quarterly meetings.
Yeah, so every 6 months we meet, the faculty members meet, and then we sit down and actually evaluate every resident for regarding many aspects, clinical knowledge, professionalism, work ethics, all sorts of, metrics. And we'll write a little report, and that's how you progress. And if there's any kind of deficiencies, that's when, everybody kind of brings it up. And we propose a plan, solution, and how long, like a study plan or something like that, or a remediation plan, and work together with your clinical mentor to get those changes to happen, and then you'll have regular meetings to make sure that the solutions are being implemented, and that happens twice a year, the meetings. And you'll meet with the program director to talk about your progress, and that's how you progress through the year.
Great. And then maybe we'll go to Dr. Liss, and he'll talk, a little bit about himself, and then also about some of the rotations. There were specific questions about rotations at the VA, private practice rotations. So we'll turn it over to Dr. Liss.
Hey everybody, I'm Mike Liss. I did med school in Milwaukee, and then did residency at UC Irvine, fellowship in oncology at UC San Diego, and then came here to start my practice. And so I mostly do prostate cancer, so everything from training from the biopsy through prostatectomy, and then complex advanced management of prostate cancer. So to answer the first question about rotations, the VA is where a lot of that work happens. So in your first year, you're learning to do regular biopsies or cystos, vasectomy, and then you have some clinic duties, obviously consults and inpatient care. And then in the second year, we teach you to do MRI guided biopsy or more advanced procedures, start doing we have capability in clinic to do x-ray, so we could do retrogrades in clinic and various things like that. And then as you get to be a chief there, when you come to clinic, I have you manage some of the advanced patients, and we take you through how to talk to patients about counseling after prostate cancer diagnosis, and how do we go through that, and how do you efficiently communicate all these like lists of things to a patient in an efficient visit. So by the time you're done, you should be able to do it within 20 to 30 minutes. But sometimes it takes an hour, their first shot at it. So they'll watch me, and then we'll go back and forth. So that's kind of the training ground to do some of those things. But we also have a lot of bladder cancer, kidney cancer, at least for and I'm speaking mostly on cancer because that's we've condensed it to like Wednesdays is our kind of our cancer day there. So we could see a lot of stuff that day. So then as far as private practice, there's a practice in town that you rotate through. It's a Methodist hospital rotation. So they do bread and butter urology and kind of all the different aspects of urology as well, which I think is a nice part of the program. And I always thought when I was looking that I wanted to have a VA, a county hospital, a private practice rotation, so you can kind of get the whole breadth, and some of the autonomy happens at some of those places. So I think we have all those facilities, and then all the different docs that do various different complex surgeries are available here too. So you're going to see probably the hardest stuff that you and my training in California, I came here and I was like, wow, this is a lot harder. So.
And so before we move into the research, because you can speak very well to that, I'll just kind of give people an idea. So our city and our program is very unique in that all the main hospitals are in the medical center. VA hospital is attached to the medical school. The private practice hospital that you work at is literally right across the street from the university hospital. So all of these hospitals are, within walking distance really of each other. And so it makes it very easy for you to kind of go to a conference and then go to your clinics and whatnot. And then in terms of the VA, there's also Dr. Kraus. He's pretty well known in the neurourology world. And so he has his spinal cord clinic there. Dr. Rosansky's is one of our newer faculty, and he'd done a fellowship in male reconstructive urology. So he's also got his clinic there. So they're doing artificial urinary sphincters, they're doing inflatable penile prosthesis. So you get a lot of that exposure at the VA, and it's a real asset. And like Dr. Liz was saying, the university hospital, we get really hard, tough cases. But when you get your private practice rotation, you also get the opposite. You get some pretty straightforward, easy cases that maybe for majority of residents, that's kind of what you're going to see, and so you get that nice balance. I wanted to have Dr. Liss as well talk about the research opportunities for residents and how that works.
So for research, most of our faculty participate in some form of research. Now that could be health services research, it could be clinical trials, which is much tougher for residents to participate in just because you're rotating on and off, but a lot of times we can involve you in different aspects. But really it's going to be what you want to do. So if you're going to go to a faculty and you say you want to do X, we'll help you through that for sure. We have quality improvement projects. Each resident at every program will have to do some type of quality improvement project, but then you can turn that into a research project if you're passionate about it. And then you have a research mentor that you can communicate with regarding your research. So I always recommend, you start early in your, once you come on to urology or even beforehand, to identify what you're interested in, what you want to research. But a lot of it's going to be directed by you. As far as your interest, it's hard to give you a project that you're not interested in. You won't finish it. So I'm always looking at you guys to say, okay, what are you interested in? What do you want to do? You have to be passionate about it to do research. And I do research, and basically people tell me that thank God you do it because it's so difficult. And to do research, there's IRBs, and there's all these paperwork that you have to do, and so you really have to be passionate about it to do it. So I'm always willing to help. We have stats people to help with those projects and whatnot. So I don't know, Pruthi, did you want to add anything?
Yeah. No, so that's fantastic. Yeah, so that's the other piece of it. I think we have a monthly journal club, and we've kind of changed the journal club where we're trying to teach you how to essentially dissect an article. What's a case control study? What's a cohort study? So we're really trying to educate you so that when you're out there, as practicing urologists, when you see a paper that's in front of you, you can actually critically appraise the literature. And we really want you engaged early on in doing research. And like Dr. Liz said, we do have biostatisticians on our in our faculty who can help with the projects. And really, everybody's project, the people who are really motivated, like currently we have residents right now at an AUA sectional meeting, and I'm getting text messages from them. We have a medical student, presenting his data that we've worked on together, and some of our residents as well. So, if you're motivated, the data's here, and all of us are very much motivated to do research. So that's there. We still have 3 more people to talk. It's 7:35, so I want to kind of move through it quickly. I want to move to Dr. Botros, and then we'll go to Dr. Kaushik, and then I'll wrap it up from the faculty point of view. So, Dr. Botros, I think you're on the phone, right? Oh, yeah, there I see you.
Hi. Sorry, I
Hi.
apologize. I'm in my car. My 12-year-old is playing football, and those games happen to be after work on Thursday. So I'm like sitting in the car, so hopefully I can catch the end of the game when we're done. But so hi and welcome. My name's Sylvia Botros Bray. I'm a little bit unique in the urology practice. I'm an OB-GYN trained physician, but I'm a female pelvic medicine and reconstructive surgeon. And so that's the reason that I'm in urology. So I actually think that it gives you guys an opportunity to see both sides of that specialty. And we do have a fellowship here that's accredited by the Board of Urology, but we take both urology and gynecology residents. So I think that's kind of a cool addition to the program.
Great. And there's a couple questions, and I like to add, we had one resident a number of years ago.
You're all interested in.
Oh, we just lost you.
Can you hear me? I think hold on.
Sorry, go ahead.
I'm from all over. Can you hear me now? I'm from all over. My parents are immigrants from Egypt. I was born in England. I moved to Buffalo, New York, and then grew up in East Texas. Got married, moved to Chicago. I did my training in Texas at University of Texas in Houston, and then I did my fellowship in Chicago, and then I'm back here as faculty. I was in Chicago for probably 15 years, so I can't, been a lot of places. It's hard, don't really know where to call home now because I've lived in Texas and Chicago probably about the same amount, but because home is where my family is, so they're here in Texas with me. Yeah, and I think there were some questions about professional development of residents and how do faculty help residents reach their goals. So I actually hope that it's become a little more clear to you how faculty help residents reach their goals just from listening to the discussion about research. Obviously, we have most of the subspecialties covered, so any of us that are in the subspecialties are always thrilled and excited when our own are interested, and we'll do whatever we can to help. We've got the research support. The institution is implementing several GME tracks, so they're going to start working on a health science system GME track that if you were really interested in, definitely we could consider that. They've also started, they're piloting now the medical education track, and I think there's more to come So definitely opportunities within the residency and also outside of the residency. I'm trying to think what else with regards to goals. The mentorship that we mentioned, I think that's a key into helping you reach your professional, in your professional development and reaching your goals. So when you come here, you're assigned 2 mentors. You're assigned a research mentor, and you're assigned just kind of an overall, and I'll probably use the word advisor, that you're, the structure is that you'll meet with them every 6 months, and then how more frequently or less frequently is really dependent on you and your mentor. And so some people meet more than that. That answer that question? Is there anything else you guys want to add to that?
Well, that's perfect. And we have Dr. She also, by the way, Dr. Botros runs a wellness, conference every 5th Wednesday, and the residents have found that very useful. Pre-COVID, sometimes we would have, I think, volleyball and so it's more fun activities, but there's also some of the didactic pieces which are enlightening as well. So she in fact just had that on this past Wednesday, so it's very well received. We have Dr. Kaushik here, and Dr. Kaushik, I'll have you introduce yourself, but the 2 questions I'll direct to you are maybe what you think we're looking for in a resident, and talk about work-life balance.
Hello, everyone.
Hi.
Hi. I'm Dharam Kaushik. I'm outside my daughter's school, waiting for her to come out. I actually trained at Nebraska. I went to University of Nebraska in Omaha, Nebraska, did my fellowship at Mayo Clinic. Now I've been a faculty for 7 years here. And it has been a phenomenal experience for me. The cases I've seen and done, it's just crazy. The amount of cancer we have seen, the volume, it's just amazing volume, and it's a great training environment. The bottom line is, if you train here, you can do essentially any urologic case, whether it's open, robotics, or laparoscopic. There are not many places in US where you can have that much training. Some programs may be very robotic heavy. Some programs may be very laparoscopic heavy. And there are only few programs where they do open surgery. This place offers combination of all 3. So we have a fellowship in oncology. We have enough volume to support full training for residents and 1 fellow. So what was the question, Deepak? You had 2 questions for me?
Yeah, and then that's great. So the other one was maybe if you could speak to work-life balance, and maybe what you're looking, what are things that people would look for in a resident, especially maybe in our program, for instance.
Yeah, work-life balance. I think that's, so this place, I mean, I think most faculty in our department, they are all for work-life balance. We have a wellness conference. We have, mentorship model where you meet with your clinical mentor every 3 months. And this is not just filling out some paperwork. It's actually, he or she actually sits down with you and talk about what's going on with you, what they can do to help you, and how they can promote your wellness. So there is a big push for talking about wellness, mindfulness, all these things. And we are actually already taking a lead by proactively involving our faculty into wellness, into talking about inclusion, diversity, equity, and mindfulness. All that is a structured part of our program, either in conference or faculty meeting or resident meeting.
Great, thank you.
Yeah, Deepak,
That's awesome.
Was there any other question?
Yeah, just maybe if you could speak just briefly, like, one person had a question of, what are we looking for in a resident? I mean, there's general things that everybody is looking for in a resident.
Yeah.
But maybe something, if there's a San Antonio twist to that question, if there's something you could think of.
Yeah, so I know most medical students who are interviewing, they think about skill set and whether they're good in surgery. That's not what we're looking for. I think we're looking, because all that is, doing good surgery, becoming a good surgeon, that comes with learning the skill. What we are looking for, and I can speak for myself, I cannot speak for the whole department, but what we are looking for is strong work ethics. Do you have a mindset? Do you have a growth mindset to say, I'm going to listen to my faculty because he or she is telling me, she's critiquing me on my surgery. So I'm going to listen to my faculty and improve. Do you have that open-mindedness? Do you have a growth mindset? Do you have a resilience in saying, yes, I'm going to go and work hard, and yes, sometimes faculty may say something, but that's just for my own improvement, for my own personal improvement. So it's a growth mindset. That's what we're looking for. It's be open, because no matter what the faculty is telling you, it's never personal. It's about your growth. It's about who you will be in 5 years from now. You should be able to walk out from this program and say, I trained at UT San Antonio, and I know I can do this case without any hesitation. That's what we're looking for. So growth mindset, being open to ideas, suggestion, feedback, positive feedback, negative feedback.
Wonderful. Thank you. We have 12 minutes, and I want to respect everybody's time. So I'm going to just kind of finish off my part and still give you guys a chance to ask some questions. There were a few other questions that are left. Maybe I'll start with, to feed off what Dr. Kaushik was talking about. What is the relationship between the residents and the faculty? And I would say, there's a very strong relationship. Most of the faculty are actually relatively young. So we were, not too many moons ago in your place. And so we get it. There's really no God complex here. When I interviewed here, for instance, I was at the AUA in New Orleans, and I saw one of our former faculty, Dr. Javier Hernandez, and we happened to be at the same hotel. And he happened to be having a glass of wine. I happened to be sitting having a beer with my friend, and I invited him over, and he sat down at our table, and we just talked. And so, here I was, a third year, or fourth year medical student, or resident rather, and he didn't really have that about him. He was able to sit down and chat. So I think that really speaks to the culture here. When you think of San Antonio, people say you think of the Spurs, and that's really much that kind of permeates the culture of this city. It's not like the Lakers, the Spurs dominated with a 70% win percentage over 14 years. So they're kind of the quiet killers, and I feel like that's kind of the culture that we have here, where we do a lot of good work, and it's really good in terms of a team approach. There was a specific question on how do residents go on to fellowship or private practice. So to what Dr. Liss was speaking about earlier, part of it depends on how passionate or motivated the resident is. A few years ago, we had 2 residents who did fellowships. One did a recon fellowship at MD Anderson. The other one, she went to Nashville, so she spent 2 years there. 2 years ago, our group did not. None of them chose to do a fellowship, but they're all doing private practice. One of them actually called us earlier this week, and he texted me. He did a cystectomy, radical cystectomy on his own on a Saturday in a really tough, challenging case. And so, I think that speaks to and he hadn't done one in a year and a half, but there he was on a Saturday doing a radical cystectomy for bladder cancer. And so I think that's a real testament to the training you get here. So some of the residents have felt that they don't need the extra, training. Some people choose a fellowship because they feel that there's a deficit in their training, and I wouldn't say that's the case here. I know historically we had a sort of, arguably true, a knock on the program in terms of robotics and robotic exposure, but that's really changed, and that changed during my fellowship while I was here. We got robots at all the hospitals. We have XIs, we have dual consoles. Dr. Kashik does cases, Dr. Liss does cases. Dr. Mansour had done a formal robotic fellowship. He's actually in Egypt right now, so he can't join us. But I learned a lot from these 3 guys for robotic surgery, and I do a lot of robotic surgery now. And so we have the volume there, and like what Dr. Kashik was saying, you also get laparoscopic surgery, and so you really get the full gambit. And there's one question specifically, how many cases per week? If you're at the university hospital, you're operating every day of the week as a chief resident, maybe with the exception of one day. And usually we have multiple rooms per day going. We do have a private practice hospital that we also, the UT faculty are at Christus Santa Rosa. So Dr. Svatek predominantly operates there. Some of us do some cases there as well, but that's his day there on Thursdays. Almost every Thursday there's a cystectomy, and he's doing them robotically or open, depending on the patient. And so there's quite a bit. Every day there's something. We have 4 residents each year, and there's 3 hospitals. So there's resident is essentially the chief at that hospital doing all the big cases. And the 4th resident is actually on their administrative role. So they're rotating, filling in for other people's holidays and whatnot. So they stay relatively busy, but it also is a little bit easier for them because they get some downtime. They can do some reading, and we talk about the work-life balance. When you're at the university hospital, it's a busy place, and so the residents are there. They're working hard, but we do a lot of different cases there. So like it was alluded to earlier, we are the largest essentially referral center in South Texas and East Texas, and so we get a lot of these kind of crazy cases, cases that are not done elsewhere. And so patients get a really unique, or our trainees get a unique perspective on managing these patients, and also the determinants of health. We have a lot of undocumented immigrants. We take care of them, and people who really don't have any, we're their last kind of stop. And if we don't do it, nobody else will. And so we really push the boundaries, for that. My practice, I'll just quickly say the next minute or so, I do a lot of urologic oncology. I do a lot of the kidney and testis. I'll do the bladders if we can get them. We have other services as well that we work with, like surgical oncology. So there may be some retroperitoneal mass that we help them with, colorectal surgery. This is a level 1 trauma hospital, and so we get all the trauma that you can imagine, gunshots, motor vehicle accidents. And so when I was here as a fellow training, I told everybody I got 4 fellowships in one. I got, a fellowship, of course, in urologic oncology that I came for, a fellowship in trauma because we take trauma call. It's nuts. I'd never seen so much trauma, especially coming from Canada. Um, a fellowship in geriatrics, because there's a lot we do. Like I just operated on an 83-year-old woman who had a carotid endarterectomy today. So, you know, there's just really old, frail people. And then a fellowship in bariatrics, because they're real big down here. So you get a lot of that. And so when you're out there, when you're done on your own, you see a normal human being, it's pretty easy for you. So you practice and you learn on the most challenging cases. So we have about 4 or 5 minutes left. Does anybody have anything they want to say? I think we were going to have a chat on the sideline. I don't know if anybody wrote anything there.
I don't see anything in there, Dr. Fruthi.
I have a question. I can just go ahead and ask if that's okay.
Yeah.
So with having a large underserved population, do you guys have any specific like outreach? I know sometimes there's like whether it's prostate cancer screening or clinics that you guys work with. Is there anything like that in the area?
Yeah, maybe I'll get Dr. List to talk about that. We'll try to keep it to like 1 minute answers, just so we can get through as many questions as we can.
Yeah, so we have a system called CareLink that if you're in Bexar County, there's like a payment program, and through them we work with them on screening processes and just trying to get people. Most of the time, we're just trying to get people covered for urgent surgery, basically. So that's basically it. So that's what we try to get people signed up for.
And Dr. List does an outreach program for prostate cancer as well. He goes to the churches and educates people as well. And so there are some community outreach if you're interested. Sorry, Dr. Botros, go ahead.
No problem. I just wanted to also make you guys aware we have something called the Center for Medical Humanities and Ethics, and they run a lot of our student-run clinics. And so if there's something that you're not quite looking for that's established in the urology department, there's definitely resources within the institution to be able to do those sorts of things as well. And outreach at UT Health, our family practice, it's really huge in outreach. I mean, it's like we had a mobile vaccine program for COVID. Like definitely outreach is part and parcel to this institution.
All right, thank you.
Yeah, and I'll just add, one of the clinics that the residents get exposure to is the downtown clinic, where we have all the underserved population. And so you really get to see firsthand some of the, social determinants of health in an outpatient setting.
I had a question for Dr. Botros. It was she mentioned like the medical education track. I just wanted to know if you could elaborate on what exactly that is, because I didn't think I understood.
The office for The office for GME is centralizing what I would call didactics that are around how to teach. So how to be an educator, how to be a teacher. It started in internal medicine probably for 4 years now, and now they're expanding it to different departments. And I think neurology and general surgery are participating. So they're working out like what the requirements are. So they're monthly seminars, and they have them like twice in the same week. So if you can't make one, you can make the other. And I think there's a requirement of having to be at 50% of the seminars. And then whether there's a teaching requirement or not is dependent on the residency program. So maybe it's developing a curriculum, maybe it's giving a lecture to medical students, but it's kind of in its infancy. So I don't have a good, this is what it looks like for everybody, because they're working out the details right now.
Awesome. So there's 2 questions in the chat, and I'm going to quickly bring those up. So one's for Dr. Sung. Can you comment briefly about clinic versus OR time throughout the program? I'll give that to you.
Sure. I guess it probably varies by what rotation you're on. In your first year, like with me, I spend probably about 50% of the time in clinic, 50% of the time in the OR. And in those 3 months, we'll do at least like 90 ureteroscopies with me, and somewhere between maybe 12 and 15 percutaneous nephrolithotomies, and a bunch of other, cases like TURPs and whatnot. I think at University Hospital it is very busy, so there are a lot of cases to go around almost every day, and so the residents who are assigned to those, I mean, they divvy them up amongst themselves, but they are probably in the OR whenever, most of the time when they're at University Hospital. Some of the other rotations, like Santa Rosa, the OR days are kind of concentration on 2 or maybe 1 day a week, and the rest of the time you'll be seeing oncology clinic, learning about how to manage stuff as an outpatient. And then the VA is also very busy, but at the VA, like VAs for training programs is the residents are the bosses there usually. And you run the clinic, you decide who goes on the OR schedule, and you do all the cases. So they have several residents there, and they have enough to run multiple rooms at the VA on certain days. So
Great, thank you. So there's another one that came up, but I'll go back to maybe Dr. Getz. Can you predict any changes to the program in the near future, or talk to those potential?
Yeah, I mean, the program, we're constantly looking at it to see if there's any improvement that we can make in several aspects, conference, structure, rotations. Is there enough cases to go around to add then another resident? So, the Women's and Children's Towers is coming up. It's gonna, I believe it's gonna open in 2024. So our volume, PEDS volume is gonna go up. My plan is also potentially expand our pediatric rotation with one of the private groups in town, person in town. And our multidisciplinary UT hospital is also going to come up, and our surgical volume may go up as well. And based on all that stuff, we may be able to have enough cases in volume, patient volume, to add an additional resident per class. That's always a possibility, but other changes, conference schedule, rotation schedule, how we do didactics, virtual, some independent learning, all that stuff.
Great. Okay, so there's another one. So I'll read it, and maybe I'll tackle this. It says, from outreach programs to research, what kind of opportunities do your residents have to mentor and teach medical students? So maybe I'll answer this, and if somebody else wants to answer, they can. But our residents have a pretty good relationship with the medical students. There are conferences that are dedicated where the residents are teaching the medical students, and those are usually after our conferences. So they're teaching them about BPH and LUTS and general bread and butter urology stuff that, for instance, if you're a primary care physician, you'd want to know. How do you work up hematuria, that kind of stuff. So there are those lectures. From a research standpoint, I do I do a lot of research with some of the residents and medical students, and usually we pair up a resident and a medical student together, and that it gives them an opportunity to mentor each other and further their growth. So there's a lot of opportunities. We also have a course that Dr. Sung is responsible for in April, where we teach the medical students how to do digital rectal exams, and then there's a short kind of small group sessions where we run through some basic urology cases, and the residents are heavily involved in that as well, where they're teaching on management for hematuria and that kind of thing. All right. So I still want to, we could stay on for a couple more minutes if there's any other questions. I would still want to give everybody a chance. I just add that, any of us are available. Most of us have, it's probably just our last name at UTHSCA, that's UTHSCSA.edu. If you can't find us there, you can just go on the website. or reach out to Kim, and we're more than happy to answer any questions. I think, just in summary, I think it's a great place. We've all come from different places and decided to make San Antonio home and UT our place of work. And we do a lot of good work here, and we all get along with each other, and it's just a really great place to grow and flourish. And I've talked to some of our graduating residents, and they say that they kind of miss it, being here and just being a resident and just the day-to-day. So I think that kind of just speaks to the nurturing environment we have.
That's why I came back.
Great. Well, we did pretty good on time. We're just 6 minutes over. So, all right. So we're here for you if you have any other questions. But good luck, and we hope to see some of you here next year.
Thank you.
Thank you.
Thank you.
Good night, guys.
Thank
you
you.
for
Have a good
coming.
night.
Bye, you too.
Thank you so much.